Total hip replacement is an amazing procedure, and frankly, it's one of my favorites. Just about everybody we replace their hip gets better. Hip replacement is done for arthritis of the hip. Arthritis is when the ball and the socket, which are normally smooth like a cue ball and pull, become rough. In hip replacement, the ball and the socket are replaced with typically metal and plastic, but we may also use ceramics. Hip replacement is done in the hospital. We use what we call a minimally invasive approach. This is a 4-inch or 5-inch incision as opposed to traditional hip surgery, which was done through 10 or 11 inches. The obvious advantages: less bleeding, less cutting of muscle, and faster recovery. You'll be in the hospital about 2 to 3 days. The surgery itself takes about 35 or 40 minutes. After those couple days, most of my patients go home. About 95% of them go home with home health and home physical therapy. The other 5% go to rehabilitation. After the first 3 weeks, I'll see you back in the office. By that point, typically you're on a cane. You might be on a walker, but that would just be for balance. By that point, your pain is gone and your function is dramatically improved. We'll begin outpatient therapy if we feel that you need it. Most people, just walking and getting back to their life is good enough. At 6 weeks, we'll see you back in the office, and often you can begin things like golf, bowling, tennis, whatever you'd like, and start to get back in your game. By 3 months, we'll say goodbye for the year. At that point, we've answered all your questions, you're doing very well, back to work, and the sports you enjoy.